My name is Michael Kharfen, and I have two titles. I am the Bureau Chief for Partnerships, Capacity Building, and Community Outreach, and I'm the Interim Bureau Chief for STD and TB Control.
What you may have seen over the city, a bunch of posters or billboards or bus signs dealing with some aspect or another of HIV/AIDS and prevention and response and getting treatment. These were all developed in order to respond to an acute need we saw of people not utilizing a lot of the services and the tools that were available to prevent HIV in this city at this time.
Where we started was trying to get condoms available to people. We went from 500,000 condoms in 2007 to over 5.5 million condoms last year. Now we're also trying to change the conversation and try to get away from the stigma associated with condoms. And this has been particularly about how I approached work in our social marketing. So whether it's been our Ask for the Test campaign around HIV testing, or Join the Rubber Revolution, or our Female Condom, DC's Doing It campaign, it's that we don't make it look like a public health campaign.
He has often reminded us that whenever you're talking about HIV, you're talking about sex. And sometimes people can become a little uncomfortable. You know, even as a contractor, he likes to tease me that I blush often when it's time to have the discussion about sex. But I mean, that's just a fact of life as it relates to HIV and other STD prevention.
He helped to really transform how public health messages are conveyed to the public and the community. And his public health messages were edgy and conveyed the messages that people needed to hear, not your traditional government public health messages.
The campaign won the Public Relations Society of America Bronze Anvil Award of Commendation, which is the leading award in our industry.
We knew we didn't just need a good campaign here or a good campaign there, but we needed a whole strategy. And so Michael, he saw the 5-year vision from the beginning, and that's how Michael helped both conceptualize but then drive the formal development of, as boring as it sounds, a contract and a partnership that would allow us to roll out a 5 to 6 year series of social marketing campaigns.
We still have a lot of progress to make, but over the 5 years, we have really seen increased understanding around HIV prevention.
And as a result, millions of condoms have been distributed all across the city. Thousands of people have been able to access medication for HIV treatment, and youth have access to prevention programs that otherwise weren't either known or available.
We also created a whole new program for young people called WRAP-MC, W-R-A-P-M-C, which stands for Master of Condoms, by the way, because we, the Department of Health, actually certify people as a condom educator. We couldn't find any other program in the country that does this. Now we have these RAP MCs in every one of our public high schools, and this year we're expanding this to now have young people be able to distribute condoms and educate their peers in school. And we provided screening to over 5,000 young people and education to over about 8,000 of them. Our Director of the Department of Health credited our condom program and our efforts around reaching young people to help as contributing to that reduction of both teen pregnancy rates.
We were able to start a school-based screening program where we go into the high schools and provide education and testing for adolescents in 26 public and charter high schools. There was some resistance around it. It was an out-of-the-box type program, and he really was able to provide direct leadership as well as passion and commitment to make sure that it got off the ground in a very collaborative style to involve other governmental agencies, community partners, and of course youth. He recognized that adolescents aren't just shorter adults or younger adults, that they're their own population and have their own needs and really need their own strategies. They helped to develop any social marketing materials, helped to develop the messages, the presentations, and really helped shape the program. And I think that was really key to its success.
More young people are getting screened. They're becoming more aware of the fact that there are STDs out there and that we're providing them this information. So we're one of only 3 cities in the country that does this. And when we go around, when other jurisdictions find out about this, they're like, how can we do this?
So under Michael's leadership, the number of community-based organizations that participated each year increased, and the Effie Berry program was originally developed to be able to help particularly small faith-based and community-based organizations in Wards 7 and 8, so some of our underserved wards in the city, to engage more effectively, more efficiently in the HIV response. This program got sustained over time, but also there was the building of an identity. Essentially, I think, became a point of pride to step up and say, hey, I'm an Effie Berry organization. And I think this project brings out a lot of the things that Michael really does well in terms of bringing a lot of players to the table, making things open and communicated and actively engaging participants, and also saying, okay, we might be starting at one level, but how do we make it better?
He's not here because it's a job and it's a paycheck. He's here because he really believes that he can make a difference in the city. There's a lot of people here and in the community who have known for a long time that he's this kind of quiet warrior who's really fighting for the residents and the visitors in the district. And he's just tenacious. He just keeps going and doesn't stop.
When you work together in a spirit of collaboration with the right leader in place, as Michael has been, you can do amazing things.
Michael is the best you can get for bringing solutions and innovation and creativity and impact into the government system. Young people who are looking at, like, why go into government? Why would you do this kind of work? Can you really make a difference? I think he embodies not only, yes, you can make a difference, but how much of a distinctive difference you can make in terms of recognizing an individual who embodies these best qualities that we would like to see in our government employees that we turn to. He's it. He's got it all across the board.